A forehead lift is correction of tissues that have descended and started to come down and block the beauty of the eye area. So a forehead lift involves repositioning of the tissues of the forehead in a more natural position. There's a lot of nuances to this, so depending on where the hairline is, depending on how thick the tissue is, depending on how much of the eyelids are blocked, we have a variety of minimally invasive interventions such as a thread lift for the forehead region, removal of skin or not, and supporting those structures with a variety of either sutures or more permanent materials called endotines. The best candidates for a forehead or a brow lift are those who notice some hooding in the outer corner. So this is a little different than hooding you just have in the eyelid. This is the temporal hooding. So it's hooding that comes way out in the outer corners. That's often when the brows have deflated and descended. So when that is the specific issue, a forehead lift is required. Eyelid surgery alone would not help. And those patients who've been using these expressive muscles a lot, and these muscles have gotten very, very big and pronounced, who aren't really good candidates for just Botox or filler alone, they're also excellent candidates because while we do the brow lifting surgery, we can soften the muscles. We can basically do some surgical interventions to prevent those deep, deep lines in the glabellar region. So again, anyone with brows that have descended, a lot of hooding temporally, those would be wonderful candidates for a forehead lift. After a forehead lift, you can expect some numbness of the scalp. That's normal because all our sensory nerves do run behind the incisions typically done for a forehead lift, but that is temporary. So the first few days after surgery, we do recommend patients take it easy with their hair dryers and they know that there's going to be some numbness. Otherwise, painless. The incisions are hidden within your hairline, so you don't really see signs of surgery. And surprisingly, there's very little bruising and swelling from forehead lifts.